Today, the unit is about navigating the healthcare system, understanding insurance, making doctor appointments, filling out medical forms, obtaining family health history, and more. It might seem irrelevant now, but before you know it, you'll be making healthcare decisions on your own. Information sheets, resources, and additional activities from this module will be available from your instructor for you to take home and practice. We will start with a video clip.
This is a POS and not a PPO.
A PPO?
It's a POS.
I want a POS or I have a POS?
You have a POS.
So you want me to have a PPO?
You have a POS and not a PPO. That means
I want a PPO?
You have a POS. It's like an HMO. It means you need a referral from a PCP.
PCP?
A primary care physician.
A POS means I need a PCP?
A referral.
The video clip shows that even adults struggle with healthcare information. We'll spend the next few slides learning about insurance, providers, family history, and what you need to know when going to a provider so you have the knowledge and skills to take care of your own health needs. These are the main topics we'll cover in this session. To increase your health insurance literacy, we need to learn the basics of insurance. If you broke your arm and went to the emergency room, it would cost a lot of money for you to see the provider, get x-rays, and get casted. Without insurance, this ER trip could cost around $5,000. With insurance, the cost could be lowered to around $600, a $4,400 difference. Before we go over the different types of insurance, we're going to test how much you know. Hint, some words are used more than once, and question 5 has 2 possible answers. You can score your own work as we go through the next slides. Pause the video to complete the workbook activity. It's important to note, not all insurances are the same. A procedure covered by one insurance plan might not be covered by another. This is why it's important to know what your insurance plan covers. There are many different types of insurance. The type of insurance someone has depends on how they get it, income, your household size, and age. If your insurance comes from a parent or guardian's job, it's known as private insurance. Most insurance plans allow you to be on a parent or guardian's policy until you're 26 years old, even if you live somewhere else, or if you get a job that provides health insurance. If you do not have insurance, you may qualify for government insurance. There is no cost to apply, and depending on income and family size, you may qualify for free or low-cost health care. You can work with a navigator to determine the best insurance plan for you. What is a navigator? A navigator is a certified health insurance expert that works year-round to help you find, sign up, and use health insurance. They help you look at different insurance plans and find the best deals for the marketplace, also called HealthCare.gov. Sign up for Badger Care Plus, also known as Medicaid. Find information for financial help, understand insurance, billing questions, and appeals. Their services are also free to use. Beloit Area Community Health Center has an enrollment counselor who can walk you through the application process for free. Once you enroll in health insurance, the next step is that you will receive a letter and insurance card in the mail. You will need to carry your insurance card with you to every visit, so it is best to have it in your wallet at all times. There are local healthcare clinics that provide medical, dental, and mental health services regardless of someone's ability to pay. These clinics will provide healthcare services for little to no cost, even if you don't have health insurance. Find local community health centers that can serve you and your family through the Wisconsin Department of Health Services website. Once you have your insurance card, the next step is to find a primary care provider. Healthcare is full of acronyms. One you will probably hear often is PCP, which stands for Primary Care Provider. A PCP is the general healthcare practitioner who practices general medicine. A PCP is usually your first stop for medical care. PCPs treat a wide range of issues and will help you coordinate your treatment if you need to see a specialist. Most PCPs are doctors, but they can also be nurse practitioners or physician assistants. Why do we need to see a PCP in the first place? Typical reasons to see your primary care physician are for your annual physical, for a sick visit, or if you need a vaccine. You can get some vaccines at pharmacies, clinics, or the local health department. You can access a copy of your immunization record from the Wisconsin Immunization Registry, WIR, if you receive vaccines at a place other than your PCP's office. Once you have a provider, it's important to save their contact information in your phone. Going to the same provider for your care that you like and trust has benefits. When you see the same provider every time, they can provide better care because they have notes from your past visits and can monitor changes in your health over time. When you like and trust your provider, you're more likely to trust their advice and feel more comfortable sharing personal information about yourself and what's going on in your life. Just remember, you have options. You don't have to see a provider you are not comfortable with and does not listen to your needs. But how do you find a primary care provider that you trust and can visit for a long period of time? Let's brainstorm some reasons. Look at the Finding the Right Providers section in your workbook for some ideas to get you started. A good starting point is to check your insurance website to get a list of providers that accept your insurance. The website will be listed on your insurance card. Once you have a list, you can search for ones nearby and read their biographies. You can call the office beforehand and ask them questions to get a sense for the office. Hi, is Dr. XYZ taking new patients? Do they see many infants? Do they speak Spanish? Ask a few questions about whatever is important to you. Here are some questions to consider when looking for the right healthcare provider for you. Keep these in mind as you start taking charge of your own healthcare. Just like you find favorite stores or restaurants you give your business to, you'll do the same with providers and their offices. Consider if the office is friendly and helpful, or if their business hours work with your schedule. The emergency room is open 24 hours a day, every day of the year. As convenient as this is, it is only meant to be used for serious or life-threatening illnesses or injuries, such as difficulty breathing, very high fever, severe burns, and uncontrollable bleeding. A minor toothache is not a problem you should be taking to an emergency room. The emergency department is an expensive trip, sometimes $150 or more even with insurance. It is also very busy, and you are likely to wait a long time to be seen, even though hospitals are working hard to reduce emergency room wait times. In addition, emergency department providers don't normally provide any follow-up care. This is why it is better to go to an urgent care center or your PCP, unless it is truly a life-threatening emergency. An urgent care center is another place you might go to take care of your health needs. Urgent care centers have become increasingly popular as a convenient option for healthcare. An urgent care center provides treatment for many conditions, including cold or flu-like illness, cuts and lacerations, sports injuries, and eye or ear problems. Many people are choosing urgent care centers because they are open during times when a traditional provider's office is not. They are also a convenient option for when you are sick or injured and you cannot get a timely appointment with your PCP. If you do not know where the urgent care centers are located, or if you are traveling out of this area and need to find an urgent care center close by, you can use this urgent care locator resource. There are many options when it comes to getting treatment, and it's important for you to be able to determine where to get appropriate medical attention for any health concerns you might face. Keep in mind that most places offer telehealth. During this activity, we will be discussing multiple cases and deciding where each person should go for care. No matter where you choose to go for care, your personal and family health history will be important to your treatment. Just like we inherit genes from our parents that determine our hair color and personality, we inherit genes that make us more likely to have certain diseases or health issues. If two people in your family have heart disease, it does not mean you will get heart disease, but it could mean that you are more likely to develop it. Information about your personal and family health history can help the provider identify your risks and suggest educated ways to reduce those risks. Family members that are diagnosed with diseases earlier than normal, multiple family members with the same disease, and combinations of diagnoses like heart disease and hypertension can all be considered risks. Though we can't control the genes we inherit, we can make choices and participate in behaviors that will reduce those risks. Take a look at the example family tree. When looking at this person's personal and family history, what health risks do they have? What health risks exist for them? Some answers include great-grandpa and mom have heart disease. Great-grandma, grandma, and mom have hypertension. Grandma has diabetes. If this person went to their PCP for a regular checkup, what do you think the provider would suggest to reduce health risks based on their family and personal health history? They could make lifestyle changes like eat healthy and exercise to reduce risks such as diabetes, heart disease, and hypertension. Your family health history can have a large impact on the treatment of your health issues, which is why it is critical you know and share your health history with your provider. Practice with an adult family member, such as mom, dad, grandmother, grandfather, aunt, uncle, etc., about your family health history and what health risks run in your family. If you cannot interview a biological family member, you may interview a non-relative or non-biological family member and discuss that person's history and why it would be important to know. The questions provided on the worksheet are meant to be a guide and can help you get the conversation started. Do not write your actual family health history on the worksheet. It is important to be on time to your doctor's appointment. Depending on the policy at the doctor's office, you could lose your appointment and possibly pay a fee for showing up late. You should also anticipate filling out paperwork when you check in with the receptionist, so it is best to arrive early. More likely than not, you will need to know information about your personal health, family health history, and insurance information. Use the sample information to practice filling out a registration form in your workbook. Again, do not use your own information to fill out the practice registration form for confidentiality reasons. The information continues on the next screen. Pause the video here for practice. Once you have an insurance plan, you will receive an insurance card that acts as proof that you have insurance. Usually, when you receive any type of medical services, you will need to show your card so they can verify your plan and charge you the correct amount for the services. Your card will include basic information about your plan. Not all cards will include all this information, but each card will include something similar. If you pay for your insurance, your name, number 1, will be on your card. If you are on a parent or guardian's insurance, you might see their name on your card. That is because they pay for it. The member, number 2, and group, number 3, numbers are a way for the insurance company to know what kind of plan you have, where you get your insurance, and how you pay your bill. You also may find the name of your plan, number 4, copay information, number 5, and prescription information marked by the symbol RX, number 6. Next, we're going to talk about what to do once you're at your appointment. Let's start with what it takes to be a good self-advocate. Being a strong self-advocate can help you be health literate. These skills are necessary to understand what the provider is telling you, and for you to be able to tell the provider what you are feeling or experiencing. These self-advocacy qualities will make it easier for you to navigate the healthcare system and help you get the best care possible. Clear communication is the ability to understand and act on health information. Ask Me 3 encourages patients and families to ask 3 simple questions of their healthcare provider. What is my main problem? What do I need to do? Why is it important for me to do this? You can ask these questions when seeing your provider, are preparing for a medical test or procedure, or getting new medications. Be sure to let your provider know if you don't understand. Ask questions until you understand. You could say something like, "This is new to me. Can you please tell me that again?" This could be a conversation with your provider about what you will do once you leave the appointment. What's non-negotiable? What you have more control over. Knowing the answers to these 3 questions will enable you to better care for yourself. It's never too early to start thinking about your health and healthcare. Improving your self-advocacy skills and becoming more health literate are the first steps to being able to take care of yourself. It is also important for you to have insurance, a primary care provider you trust, an understanding of your family health history, and know when and how to seek the proper medical attention.